Welcome to RippleFX. The 2024 Healthcare Data Breach Report is out now and available for download. Today we're talking with Jon Sternstein of Stern Security, the guys that put this report together. They've analyzed nearly 6,000 data breaches since 2009. As you might imagine, 2023 was another record year for healthcare data breaches with over 160 million records exposed. 81% of those being due to hackers. Want to take a guess at what the next largest culprit was, responsible for almost 17% of these breaches? I was shocked to find out. I bet you will be too. Let's dive in with Jon. Jon, welcome to RippleFX. Glad to have you with us today. For our viewers, we have Jon Sternstein joining us today. He's with Stern Security, and Jon is excited because they've just released their 2024 Healthcare Data Breach Report. So, Jon, welcome.
Yeah, thanks for having me.
All right. Well, hey, let's start out with maybe tell us a little about your background and Stern Security and what kind of things you guys are doing.
Sure, sounds good. I've been in the cybersecurity field for almost 2 decades now, but before starting Stern Security, my last job before that was I was leading a security team at a large hospital system. So a lot of work in healthcare, doing risk assessments, growing a team, building out the infrastructure. Once I left that organization, I started Stern Security. Initially, we were doing a lot of HIPAA risk assessments, a lot of risk assessments for other industries, doing data breach research, and then we created a Velocity product to help automate a lot of the risk assessment process and cyber risk quantification. And the data breach report started a few years ago, but for many years we created this portal called healthcarebreaches.com where we would analyze healthcare breaches, and that eventually it's a free resource. You could just go to the website and see the breaches on the site. But over the last few years, we started turning that into an annual report.
Very good. I don't know if I told you this when we chatted prior to pressing the record button, but I get the thrill of being the HIPAA compliance officer here at Comtech. So we serve, I think, in the neighborhood of 40 healthcare clients that are subject to HIPAA. So it's a very relevant, timely topic for us here at Comtech and our client base. So the timing couldn't be better. Well, let's dive in a little deeper and tell us more about this healthcare data breach report. I guess maybe start with where the data is compiled from and, what's included in just kind of your process for putting this together.
Sure. So one reason why we have really good data on this is because of HIPAA and high tech. There's that requirement that if there's a breach that's 500 or more records, that the organization has to let Health and Human Services know, but also it's published on Health and Human Services website. So they have a site with going back to 2009 of all the breaches that were 500 or more records, and you could see all those breaches listed. And so that's the primary source of that information. What we do on top of that is every breach that occurred over the year, we go through and we research every single one of those breaches. So last year there was 744 breaches that occurred last year, and our analysts went through every single one of those and saw, all right, this was ransomware. Okay, this one was a phishing attack. Okay, this one was a stolen laptop, and we get the details of all that, and we build that into all of our analysis for the breach report.
So, Jon, you're talking about what we like to call the HIPAA wall of shame. Is that right?
That is what they call it, yes.
Gotcha.
Yes, but a lot of times though, it's very basic information on that. So it'll just say this organization is a covered entity. They had lost this many records, and this is the date they announced the breach. But then they don't say anything else. They might say this originated from a email system or a network server, but you don't know exactly how that breach happens. It doesn't say if it was ransomware. It doesn't say if it was phishing. And that's where all of our research comes in.
So I'm interested. How do you go about that research? Are you calling and interviewing people, or just what does that process look like?
It is a lot of time, honestly. So, a lot of it is, I mean, part of that is not only do these organizations have to let Health and Human Services know, but they also have to alert the media as well. So, thankfully, we can find
Fun.
media articles on a lot of this information. And yeah, there's a lot of online discoveries that have to be done in addition to that. But yeah, that's one of the primary sources. So thankfully, we don't have to necessarily call as much. We usually can find most of the information online. But at the end of the day, we'll do whatever we have to do to get that information.
Gotcha. Hey, let's take a little sidebar and talk about alerting the media. That is, and to our viewers, you're going to sense a theme here because I'm all about the cyber resilience framework. And part of that respond phase is alerting the media. And the default is, hey, let's grab the CEO and push that person out there to say what they're going to say. So, how does that usually go for people? Do you feel like people are these entities that have the breach? Do you feel like they're prepared for that step?
I mean, I think this goes back to your incident response tabletop exercises. So, in your tabletop exercises, what should be done is there should be a portion where you discuss, hey, if we have to alert the media, who is actually going to be the one that talks to the media? Hey,
Right.
has this person ever had media training to actually speak to them? So I've seen both cases where somebody was very prepared and some other cases where somebody wasn't. But that I think the critical thing is to make sure that is part of your instant response exercises, and that's documented. Hey, this individual or this
Yeah.
this position is going to be responsible for that.
Yeah. Yeah. Great. Well, it sounds like a lot of legwork, a lot of
Mhm.
effort goes into this report.
Yes.
Now, help me understand who gets this report, or how is it put out there once it's put together. And by the way, is this done annually, or what's the frequency on generating this?
This is annually. So the
It
past
isn't.
3 years, this last one is our third annual report.
Okay,
That's
great,
correct.
great.
Yeah, I mean we feel very strongly about publishing this for free online. So we just want organizations to really understand how these breaches are occurring and what they can do to actually reduce their own risk. So it is posted on our website, sternsecurity.com. It is posted on our healthcare breach dashboard, the healthcarebreaches.com. We
Okay,
publish it through our social media channels, and then we work with local security groups and healthcare security groups to distribute this out to their membership as well.
gotcha. Well, that's good that you're doing this and then putting it out there for free for sure, and
Yeah.
hopefully it's helping people. So, is it me, John, or the HIPAA wall of shame, because I don't know what else to call it? Is that number, do you think it's increasing every year, or is it staying about the same, or is it going down?
Sure. That is a good question. I think most would think that it generally goes up every single year, but to be honest, it doesn't every year. I mean, this year it did go up in both the amount of breaches and the number of patient records lost. Those both definitely hit the record high.
Hmm.
But I mean, if you look at it, that record for the number of patient records lost, I mean, the second highest was in 2015. So, there was the massive Anthem breach in 2015, and many people thought that was a big outlier. We're never gonna reach those levels again, and
Yeah.
we didn't up until last year. Then we're starting to see some bigger numbers. And also, I mean, but if you look at the research in the report, you can also notice that even though we hit the most amount of breaches in any year, a large percent of those breaches were due to a single incident. If that incident didn't happen, it would have been one of the lower years for it.
Gotcha. Um, I don't know if you want to name what that incident was or not. I
Sure.
think most people know.
Sure, yeah, we go into detail in the report, but basically the MOVE It zero-day vulnerability occurred last year. So that was around end of May, where Move It, it's a file transfer application that a lot of organizations use, one of the most popular ones, and they had a zero-day vulnerability where basically a skilled attacker, if they knew the vulnerability, they could basically get access to any file that was on that system. And you got to think, if it's a file transfer system, people were transferring large amounts of data through that system. So it was announced as a vulnerability, and the organization sent out notifications and released a patch 2 days later for it. But still, I mean, we saw healthcare breaches occurring throughout the year. I mean, still took time for organizations to patch that. I mean, even there were some healthcare organizations that were announcing a breach due to the Move It vulnerability in December. I mean, and that's, 6 months after a patch was released. So at the end of the day, the Move It vulnerability was the cause of over a quarter, over 25% of the patient records lost in 2023 was due to that single vulnerability.
Gosh, wow, one event. And what was the fallout with as far as the total number of records?
That was an exposure of over 41 million
Oh
records
my
lost.
gosh. Wow.
Yeah, just due to
Oh,
that one incident.
mm,
So
wow.
yeah, that's a lot. I mean, if you look at just the cost of that, I mean, the cost of a healthcare data breach is, over $400 per record lost. 400 something times 41 million. I mean, that's just an
Wow.
insane number. It's kind of incredible that a single incident can have such a big impact on an industry.
That that's just it's hard to wrap your head around that many
Yeah,
records.
yeah,
That's a big
absolutely.
number.
Yeah.
So this is your third one, I think you said, every year.
That's correct.
So do you see any trends there, what, or what are the insights maybe from this most recent one in terms of what our viewers should be most concerned about in terms of defending against certain types of threats?
Sure. So, I mean, the number of breaches are definitely it's trending to they're growing in number. So that's trending, I guess, in the wrong direction from our protective standpoint. The breaches are also getting larger as well, and so that's why we crossed that threshold of the largest number of records lost in a year. There's also some interesting things about third parties involved. So there's a growing number of breaches that are occurring just by third parties getting involved. So third party breaches are definitely increasing in frequency. I mean, if you look at last year, third parties, or as in healthcare terms, they call those business associates.
Yeah.
They were responsible for 37% of the healthcare breaches last year. However, they were also responsible for 69% of the records lost. So the breaches with third parties were just much larger than the breaches for an internal healthcare organization. So, I mean, some of the things that you could be doing is ensure that you're doing risk assessments on your third parties, and also
Right.
just whether it's a third party or internal, I mean, just minimizing the data that you're putting in some of these systems, or that you're sending to certain third parties, just minimizing it to just what basically you need in order to complete whatever task you're doing.
So in that third party definition, are you including like EMR, like cloud based EMR, EHR providers?
Um, yes, I believe they would be listed as a business associate in this case. Yeah.
Yeah. Yeah. Okay. Yeah. We have the same, BA agreements here for our clients. So
Yep.
yeah. Wow. That's
Absolutely.
super interesting. So I
Yeah.
always like to ask in cases like this, got any interesting stories that maybe came up during all this research that you would like to share? Of course, you can change the names to protect the innocent.
Yeah, I mean the names are definitely out there. So I mean you can definitely see
Well,
that.
they're
I
on the
mean,
wall of shame, but not to,
yeah.
not to. kick them when they're down, so to speak.
Yeah, no, I think some of the interesting things are there's still breaches that are occurring through things like paper records getting stolen. Those things are interesting. We've seen some organizations that it seems like it's taken them a long time to really understand the extent of the breach because we pull the records from Health and Human Services, every every day that it's getting released. So we're always pulling the more recent information. One thing that we notice is a lot of organizations they know a breach has occurred, but they just don't know how big the breach is. So initially they'll put in Health and Human Services and said, "We have a breach," and you'll see the number of records lost as 500 or 501, and then a few months later, it changes to something much higher. So it sounds like they knew a breach occurred. They didn't know how big it was, but they submitted it to Health and Human Services as a placeholder, as they didn't want, there's a certain time period they have to submit it within, 60 days. And then later on, after the investigation, they said, "All right, this is actually much larger than it was." So there was one case um, where an organization, I believe it was a cancer institute, where they initially said it was a breach of, I think they said 500 records, and then they later changed it to like 90,000 records a
Oh
few
God,
months later. So
they're off just a
you can,
little bit. Yeah,
yeah, I mean,
yeah.
definitely tell that it was a placeholder initially. So we've seen a number of those. I mean, and then there's tons of incidents of ransomware where organizations were held hostage for that. So I mean, ransomware is still a big problem with the breaches. So
Yeah.
yeah, there's tons of those incidents.
Any interesting stories, maybe of social engineering trick that was just be unbelievable that come to mind?
um, I think we're probably going to start seeing more about you hear reports about social engineering using AI and people having their voice and video changed. We didn't see any in this case, but I would not be surprised if we start seeing some of that in our next year's report. So, but yeah, I mean that's that's definitely something that is coming up. I mean, there's another thing that there were a number of organizations in healthcare that were using um, Facebook's Metapixel software to just track visitor traffic within their environment. So just like Google Analytics, Facebook has their analytics where you can say, "Oh, just put this little bit of code inside your website, and we can tell you how many visitors are going to
Yeah,
your website."
yeah.
But a number of healthcare organizations had to announce a breach because of that, because Facebook was collecting not just the counts, but also any data that was flowing in there. So if some organizations put that code within a patient portal, which means that Facebook had access to whatever data was inside that patient portal for those
Wow.
organizations. So yeah, in 2022, our breach report noted that there were at least four healthcare organizations that announced a breach because of that. Last year, it was 13 organizations really mentioned that there was a breach because of that. So I imagine that we're gonna see more of that.
Goodness. It's amazing how cyber crime just continues to evolve, and AI concerns me. I'll say it that
Yeah,
way.
yeah,
So I personally work a lot with medical practice managers.
okay.
Is your report, you think, something that would be helpful to that group in terms of gaining some insight into what's going on in security and measures they could take?
Yes, absolutely. I think that it's something that's essential for them to look at, and they don't have to have the security expertise to
Okay.
take care of that, but at least they should be aware of how breaches are occurring, because then they would know, oh, these we're having a lot of breaches because of lack of encryption. Maybe we should get some help with somebody to encrypt our laptops and desktops.
Yeah.
There's also, if you look at a lot of the Health and Human Services, when they look into a breach and they end up finding an organization, most of the time when they end up finding an organization on top of the breach, you'll see that the organization never had a comprehensive risk analysis. So that's something else that these organizations can say, you know what, we have not had a comprehensive risk analysis. That's probably something that we should take care of, and that's also a HIPAA requirement, regardless. So
Yes.
um,
Yes.
that's something they should take care.
And it's just good practice for cybersecurity well-being.
Yes,
Say
absolutely.
that again, John, kind of loudly.
Yes, do a risk analysis. Please do a risk
Yeah,
analysis. Not only best practice, but it is a requirement for healthcare organizations.
yeah. I mean, we go through it just as a BA to
Yep.
be, HIPAA compliant. So yeah, great idea to
Abs
do that. Uh,
yes.
I, I think in a lot of private practice, these practice managers are overwhelmed. So
Yeah.
that is one area where I think it makes sense to outsource some of this to a third party that specializes in HIPAA
Yeah.
compliance and can walk you through it, hold your hand, and guide you through some of these requirements because these people are trying to run a business and run a practice, and it's just one more thing, one more box they have to check, but it's an
Yeah.
important box.
It is a
um,
very important box, and yeah, I mean, these organizations shouldn't have to worry about that stuff. So it makes sense for them to have somebody else. If they don't have the resources to have full-time staff to take care of this, then absolutely, there are organizations that will help them with that.
oh yeah, and speaking of that, IT managers are overwhelmed as well. So even more reason to maybe enlist some help on these things.
Absolutely. As long as it's getting done, just make sure
Yeah,
the work's getting done.
and then it needs to be reviewed at least annually
Yes.
for
Yeah.
sure. Yeah,
Absolutely. I mean, threats change, so these risk analyses they need to change also with the modern threats, and that's also why it's important not only for the organizations that are getting the work done, these covered entities, but also the organizations that are performing the risk assessments. They should look at our breach report to actually understand what they should be
yeah.
adding into their risk assessment process as well.
So you've got insights into all this data, and you've seen it historically. Moving forward, what are your biggest data privacy concerns?
I think some of my biggest concerns are just the amount of data that is getting lost. I think that a lot of organizations end up either storing data they don't need or just requesting data that they don't need. I remember when I was even when a long time ago when I was at the hospital, there'd be times where we'd work with third parties and and the team that's working with the third party would say, "All right, we're going to send all these patient records to this third party," and I would stop them and I'd say, "All right, why are we sending this all the data fields to them?" They said, "Oh, well, we just figured they might need it just in case." And say, "You know what? We should ask them exactly what data they need and only give them that amount of information. Don't just give them data that they might need." And I think that's a lot of times organizations run into a lot of problems with that. Make sure you're only giving the amount of data that's necessary. I mean, if you look at the Move It breach, I mean, these are file transfer servers that had all this information on there. So organizations should probably think about if they're transferring data, maybe only put the patient records on the system for just a limited amount of time to get that transfer completed. Remove it afterwards if it's not needed anymore. So not only dealing with only the limited amount of information, but also retention. Don't retain data that you don't actually need on those systems. So I think there's plenty of things that organizations can do, but minimizing data, that's one thing I'm worried about. One of the other things I get worried about is just in general people getting so desensitized to hearing about some of these things that they just
Mm,
stop caring about it. And once you stop caring about it, then everything breaks loose over here.
that's
So
a good point.
just understand that, you know, the as a provider side, but also as a practitioner side, our job is to protect that patient information and really we're doing a complete disservice um, to our the patient's well-being if we're not only taking care of them physically but protecting their digital identities as well. They're expecting us to do both for them.
Wow. So, John, for people that are not familiar with Stern Security, maybe just take another moment and we'll kind of recap. What services do you guys provide, and you know, and who are your industries that you're serving? Obviously, I'm assuming you do things for healthcare since you have this data breach report, but
Yeah.
kind of what is your bread and butter, if you want to put it that way?
Sure, sounds good. Yeah, we service any industry, but we have a lot of healthcare organization customers. I mean, we do a lot of work in the healthcare industry, but from a cybersecurity standpoint, we cover the whole risk assessment process. We do security testing, virtual chief information security officer work. We have a platform called Velocity that does the risk assessment process and also ties it to financial means, saying here's how much it costs to actually fix these issues. Our We have a wide variety of small to large customers, but we also give a lot of our things for free, especially for smaller organizations. So smaller organizations can use our Velocity product for free to assess their baseline risk within their organization. There should be no reason why an organization just does not have any means to secure their environment. So that's why we do that. We have this our vision, and our company vision is secure the planet. So we said some of these customers will not have the funds to secure their environment, but we can give them free things to actually help them out. And so we have that free platform, but we also do security testing. So we test and find the vulnerabilities before these bad actors do as well. So
Gotcha.
that's what we do.
That's good. I love that mission. That's awesome.
Yeah,
So,
thank
as you
you.
know, John, we're an MSP, and part of what we provide is cybersecurity suite. We're all about the zero trust framework. So,
Yep.
do you guys work with MSPs? Uh, Maybe as a scenario.
Yeah, we work with a lot of MSPs, and we have a partner program as well. So we do that. We partner up with them on both the security testing side, but also in our Velocity platform as well. So
Okay,
we have a partnership program for that where they can manage their customers through our platform.
great. Well, you and I have some things maybe to work out on that front, but that sounds exciting.
Absolutely.
Yeah.
Sounds good.
So let's maybe move into some takeaways for
Sure.
our viewers, especially the ones in healthcare.
Yep.
Maybe if you want to do a top three, top five, I'll leave it up to you. Just kind of
Sure.
the nuggets here that we want folks to take away from this session.
Sure. I think that knowledge is power, so organizations should absolutely read the report. I don't want you to think that all is lost because, um, all is definitely not lost. There are things that you can be doing and you should be doing to reduce risk. So the number one thing you should be doing is a risk analysis. That without a doubt, make sure you get that done. That really should help you with all the rest of the things. I mean, if you look in our breach report, we list a number of items. The risk analysis is number one, but also look at your third parties. Any company that has access to your patient information, you should be making sure that they've done a risk analysis too, and they are protecting your information.
So,
One, oh, go
John,
ahead.
sorry, I'm going to
Yeah.
interrupt you for just a moment there. For our non-technical viewers, maybe just a quick description of what is a risk analysis
Oh,
exactly.
yeah. Great point. So risk analysis is basically looking at uh, looking at all the risks that are out there that could affect your organization. So if you look at Health and Human Services on their website, they have a tool. It's a free tool where they list like, hey, there's a whole bunch of questions where they ask you, and they'll tell you if there's risk to your organization. Same with our Velocity tool. We pulled all that information into our tool as well, and you can do this for free. But basically, they'll ask things like, Do you encrypt your laptops? And if you say, you know what, I don't think we do encrypt our laptops, then that is one of the biggest risks to your organization. If one of your physicians has a laptop stolen, you have to announce a breach because
Mm.
that data is accessible by anybody. They'll ask you, do you have endpoint protection? Do you have antivirus? If you say, actually, we installed it on one machine, but we have not installed it on all of our machines. That is another risk. So there's a whole list of things that cybersecurity professionals have come together and said these are the things that you should be doing within your organization. And a risk analysis walks through that specifically for a healthcare organization, at least for the HIPAA risk analysis.
Perfect. Thank you for that side note.
Yeah.
Yeah. Sorry to interrupt. Back to your takeaways.
No, but I mean that really tracks everything else. The risk analysis is kind of like that glue that brings all these things together. So we could say,
Yeah.
yeah, you should have encryption, you should have antivirus, you should be assessing your third parties, but all these things should be in a comprehensive risk analysis. So absolutely you should have that. I mean, one of the other things that I like to make sure drive home here is just minimizing the amount of data that you have and you're asking for and storing. So some organizations really do not need the social security number of an individual. If you don't need it, do not ask for it because you may need it, eventually. Absolutely.
Mm.
Just do not collect information that you do not need. And then if you don't have the data, you don't have to protect it as well.
Great point, and that's something I've never even thought of, honestly. 'Cause I think it's really easy to just send everything you have on someone.
It's very easy. So, yeah, definitely check out the report. I mean, some of the other things we mentioned in addition to the minimizing data and the risk analysis are asset management. So that's just knowing all of your devices within your organization because you can't really protect what you don't know you have. So
True.
oftentimes we'll do security testing for an organization and we'll find we're able to get into this one system that has tons of patient information. And when we bring it up to the organization, they say, oh, we didn't even know that computer exists or that server existed. We had no idea that it was within our environment. So you won't believe how many times we hear that. You have to know all of your assets within your organization. Otherwise, you can't protect it. So asset management, patch management, make sure everything's kept up to date. Even to your phones. I mean, if you have iPhones, there was a new version just released a couple days ago, so make sure you have that patched. Make sure your computers are always patched. And there's so many times where I'll go into a healthcare facility and the physician will be on the computer and I could see a little pop-up there saying, "Oh, you need to run your patches," and they just click ignore on there, and I'm like, "No, don't ignore that. Click update." There's so many times that happens, so
Oh
it's
yeah.
absolutely essential to do that, and also just try to limit access. There's so many times where everyone has access to everything, and I mean
Yeah.
we've been focusing on hacking incidents in this discussion, but there's a good percentage of breaches that are occurring just because um, employees are accessing things they shouldn't be accessing too. So, 16% of the breaches last year were due to just unauthorized access that somebody just should not have had access to something that they got access to. So it wasn't a hacking incident. Just
So John, 16% was unauthorized access. And when I first hear that, I think, oh, someone's curious because, a celebrity or whoever walked in and was treated, and maybe the staff member's not actively involved in that patient's
Mhm.
treatment, but they're just kind of snooping.
Yeah,
But I'm getting it could probably be other things that fall under that
yeah.
unauthorized access category. So maybe clarify that because my knee jerk response was, oh gosh, you get people just kind of snooping. Um,
Yeah,
break that down a little bit for us.
sure. So, unauthorized access could mean several different things, and what we've seen in our breach reporting is that yes, that is one of the cases where healthcare workers are looking at patient records that they shouldn't be looking at. That is one of the cases. Another case for unauthorized access and disclosure is just patient records getting sent to the wrong patient. So sometimes there's mailing errors where an organization will send out mailings about patient records and they'll put the wrong address on the
Mm.
mailings, and those patient records get, accessed by the wrong patient. So that's something that has to be announced as well. And then we also see cases where healthcare organizations are inadvertently publishing patient information. So maybe there's a mistake on the website where they accidentally make a field visible that shouldn't be visible, and all of a sudden everyone can see patient information. Or maybe they leave a storage or file system publicly accessible, and a security researcher comes across it and says, oh my goodness, this page has tons of patient information on it. So they weren't hacking into the system, they just came across this open page on the internet that just had tons of patient data. They notify the healthcare organization, and now they have to announce a breach. Not a hacking breach, but
Yeah.
unauthorized access disclosure breach as well.
Well, and the first time you hear that term, it kind of sounds like a could be a hacking thing. So
Yeah,
if I'm hearing this correctly, this is more of a internal procedural
correct.
issue, and not necessarily a cybersecurity issue.
Absolutely. That is
Yeah.
correct. So
Wow, you said 16%?
16%.
Oh
Yeah, I
my,
mean,
that's
definitely
astounding.
hacking is the biggest. Hacking is the 80% of all the breaches, but yeah,
Yeah.
16.5% were due to just unauthorized access.
Wow. See, that's a takeaway from the report right there that I would have never imagined that number would
Yeah.
have been that high.
Yep. That's a lot.
That is incredible. So
Yep.
I'm I'm always preaching the concept of least privilege access, especially when we
Yep.
talk about a zero trust framework. That's one of the
Absolutely.
big pieces of that. So, your guy in shipping should not be able to see the HR stuff, right?
Yep.
Stuff like that.
Absolutely. And that
Wow.
happens way too much. So,
Wow. Well, John, that's all great, insightful information. Thank you so much for hopping on today to share that with us. And just one more time, we'll put it in the description, but real quick, the report is available. Give us those URLs again.
sure, if you go to sternsecurity.com, you can go to our publication section. You'll see it right there. You can also get it from healthcarebreaches.com, where you'll also get an executive dashboard showing all the healthcare breaches since 2009. But we also have a link on that page directly to the breach report. So sternsecurity.com and healthcarebreaches.com.
Fantastic. And before I forget, so my producer doesn't yell at me, if you like this content today, be sure to like and subscribe so you'll catch the next one and be notified every time I have a new release. John, thanks again for being on today. We certainly appreciate it and hope to have you back on sometime down the road.
Deal. Thank you for having me.
All right. Thanks again.